Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is your opportunity, as always, to get your COVID questions answered. You can put the questions directly into the box below or use the hashtag AskDrArwady on either Facebook or Twitter. Today is March 3, 2022. We were not on Tuesday just because there was a lot of things going on with AV and all kinds of things being scheduled. But certainly we've been getting questions in, and we'll be hitting those as well as live questions. So as always, we will start with our data. And let me go ahead and pull up the dashboard. So chai.gov/COVID-, as you can see, we are now averaging 199 cases per day, where we were at 282 a week ago, down 29%. That's really good because it's in the context of being down 7% in our testing. So that is a true decrease there. We're averaging just 14 hospitalizations a day and 4 deaths a day. Vaccinations are also lower than they've been, though, at 3,400 a day. Testing, 24,000 a day, very high, and our positivity is at 1%. So I am very happy to see the 199 cases per day, as well as that 1% positivity. And let's go ahead and take a little bit of a closer look. So first of all, those of you who follow us on social media saw yesterday that we did share the daily average of COVID cases has decreased by 97% since our Omicron peak, and that's the average. From almost 7,000 on average back in early January, we had hit that 200 daily average yesterday, and we're even a little bit below that today, so exciting to be there. Our community transmission and risk matrix, therefore, using the old matrix, not the CDC's new measures, which we will be talking about, are you can see everything is now in lower transmission or even low where we're talking about positivity. So great to see that, and everything's continuing to decrease. The highest daily case count, over 10,000 cases back on December 28th, having gone from 10,000 down to 199 is a dramatic drop. We've not been this low in cases since July of 2021. And in July of 2021, we were doing about 1/3 as much formal testing, meaning testing in laboratories. So even knowing there are a lot of tests happening in the in the community, our laboratory testing is still 3 times what it was over the summer, and yet our levels are where they were, and so we're really in the best control that we've been, which is great. Also, just wanted to highlight again, we are in that very low risk level of just the 1 to 25% of having even one person having had COVID at either a 25 or a 50-person gathering. This is dropping by the day, remains very low, and we're in good place. Positivity similarly peaked January 1st at over 20%, now down to 1%. Hospitalizations peaked the 4th of January. These are new hospitalizations of Chicago residents each day. That's what's on the dashboard. At almost 300 Chicagoans got admitted to the hospital January 4th, and today we're at 14. Hospital census also way down. We were at 1,600 as of January 12th and 196 as of today. And our capacity is good. When we're in double digits, we're happy, and when we're above 15%, we're very happy. So 16% of our non-ICU beds are available. 17% of our ICU beds. That's gone from 330 down to 53. Number of you were writing in wondering about BA2, what's happening with subvariants. And so I just wanted to show you this. This is also available on our website, but across the whole Midwest and consistent with what we're seeing in Chicago, each one of these vertical lines represents a week. So you can see back in November, we were almost entirely Delta, and then how quickly we saw the dark purple of Omicron, B.1.1, come in and displace really displace Delta. We are seeing 0% Delta at this point, also 0% of other variants. Everything we're seeing is Omicron. 94% of it still is just that B.1.1, the dark purple, and a little bit less than 6% in the nowcast estimate is that BA.2. So it is growing a little bit, but the nice thing is it's been, showing up here for well over a month, and we're not seeing that quick displacement like we saw of the Omicron of the Delta, and we've continued to see dropping rates in that standpoint. So keeping an eye on things certainly, but no major cause for concern there. I wanted to talk, a lot of you were asking about the CDC new metrics, what did I think of it? So I wanted to just talk a little bit. The original CDC risk table was all the way back from the fall of 2020, not 2021. So prior to the availability of the vaccines, it really reflected the goal of limiting transmission in anticipation of vaccines being available. And neither of those main indicators had anything to do with medically significant disease or healthcare strain. The community transmission levels really being driven by case incidents, new cases, doesn't differentiate between mild and severe disease. And so just to remind you, for Chicago, we had metrics before the CDC did, but they matched quite well where we had set various risk levels. And so for Chicago, when you put it for our population, that higher meant over 400 cases per day. We also, here we said over 800 would be the really very high risk, between 200 and 400 and that substantial, and then under 200 is really when you're in good control. I do want to point out how different positivity was when they were looking at this nationally back in the fall of 2020. We have always done a lot of testing here in Chicago compared to the rest of the country. And so look at this, like less than 5% was considered good, and even sort of 8 to 10% was considered decent. That was not a good number for us here. We've always been a little bit, we do more testing here. So we have been following those, but as you know, all along we've been following healthcare capacity very clearly, and we've been using our same matrix for months and months and months. So the new guidance is, I think, very good overall, just to put that right out there, and we're going to talk about it. These new COVID-19 community burden or community risk levels, where CDC is determining a risk level for every county in the U.S. It matches a lot of the same language I've been using. We did have some opportunity here in Chicago to weigh in the stages where they were thinking about what this should look like. Obviously, we were pushing hard on making sure those healthcare metrics were included, not just us, but others. And so really emphasizing again that we are in a new phase of this pandemic, mostly because of vaccines, but also because there are effective treatments that are developed and increasingly available. That Pfizer oral treatment, 89% drop in the risk of being hospitalized or dying if people get those treatments early. And as this becomes a disease that you can prevent severe outcomes from with the combination of vaccine and treatment, that is important. And it is different than we were before this was available. Also, the very large majority of Chicagoans have some immunity. 77% of folks of all ages, including kids under 5, have had at least that first dose of vaccine. And we've got a lot of folks who were previously infected, which gives some protection. Again, the best protection is the combination of people who have both recovered from COVID and been vaccinated, but one or the other gives you some protection. We estimate at this point, well over 95% of Chicagoans have at least some immunity. And our ability to prevent or reduce severe illness makes it much less critical to be focused on stopping every case. We want to focus on, having this be a disease that doesn't make people critically ill, that does mean extra protections for higher risk people, et cetera. But we don't expect to be able to eradicate COVID. We haven't expected to be able to do that for, goodness, more than a year probably, once we saw these new variants really emerge and continue to emerge. As the virus keeps circulating, we have to prevent variant overwhelming our health and healthcare systems. As you know, when hospitals get overwhelmed, we had more people hospitalized with Omicron in Chicago than at any prior point in COVID. They can't provide the best care for COVID patients. They can't provide the best care for people experiencing other health crises. We see emergency departments get overwhelmed, long waits for care. You really see these indirect effects that are not acceptable. And so looking at the severe cases that require hospital care and use healthcare resources, as well as, of course, continuing to monitor the overall number of new cases, gives us a better picture of COVID impact on our communities. So I thought I would just talk you through the CDC metrics, very high level. They have divided the country overall, each county. Once a week, they're updating low, medium, or high community burden. At low, we're seeing a limited impact on the healthcare system. We're seeing low levels of severe illness. At medium, we're seeing some impact on the healthcare system, more people with severe illness. And at high, we're seeing a high potential for healthcare system strain and high levels of severe illness. Now, what leads to these? What leads to impact on the health system? Of course, our cases in the community, our transmission, are a lot of unvaccinated people. You know, there's a lot that can kind of go into this, but I like it. It's pretty straightforward. When you're at a low community level, the most important things for the general public on the left, stay up to date with your COVID vaccines and get tested if you have symptoms. Testing is not going anywhere. Isolation is not going anywhere. Quarantine is not going anywhere. Masks continue to be required, for example, in days 5 through 10 of isolation and quarantine, et cetera. And then at the state and local level, obviously continuing to work on vaccination, ventilation, access, equity, testing, treatment, outreach. All of this is what we're doing. Medium is really about making sure that people who have underlying precautions, again, this is the recommendation for the whole U.S. We know many people are more conservative, which is appropriate, but in addition to staying up to date with vaccines and getting tested, this is about really folks who are higher risk, making sure that there are things in place. So this is where making sure there's screening testing, making sure there's prevention measures for high-risk congregate settings. This is where you might see masks come back in less vaccinated settings, et cetera. And then at high, masks are back on. Everybody should be wearing a mask indoors in public. You should be staying up to date with vaccines, getting tested, additional precautions. These are the sorts of, hopefully we'll never see this again, right? But the way COVID has been behaving, we've been seeing new variants emerge, et cetera. I want you to know that should we get into trouble, should we be seeing increases, we would be, as CDC said, considering these specific setting recommendations, we probably would be requiring masks again in public spaces. We probably would be requiring vaccinations again for certain higher risk settings. I don't expect this to be anything that happens anytime soon. Hopefully we don't see it again, but please know that there is a lot of planning and metrics in place for whatever comes. And then regardless of your community COVID community level, you should mask. If you have any symptoms potentially that go along with COVID-19, if you've got a positive test, if you've got exposure to someone with COVID, we want everybody continuing to mask in those settings. And so what did that actually look like in terms of the numbers? So on the left, you look at how many COVID cases per 100,000 people in the last 7 days. Basically divide that into fewer than 200 per 100,000 or more than 200. And then the main 4 indicators have to do with, it's actually 2 indicators, with how many people are being admitted to the hospital and then what percentage of your staffed inpatient beds are taken up by patients with COVID, similar to what we've been following here. And for Chicago, we are lower in all of these. We have a lower number of cases. We are less than half of this cutoff for COVID-19 admissions. We're less than half of the percentage of staffed COVID of staff beds at this point being occupied by COVID patients. And so therefore and if you really look, Northern Illinois is all in that lower risk. 23% of counties in the US and about 30% of the US population are at that lower risk. You can see about 40% of counties are medium risk. And then there are some counties that are higher risk, including in downstate Illinois. So, the recommendation there from CDC is everybody should be wearing a mask in indoor settings, for example. I think these are good. We continue here. We're following as you know, we used our original metrics to come off the Omicron surge. That's why I started with those. We will also be updating and continuing to, share this version as well, but I wanted to explain them. We continue to hit nice benchmarks, rounding up now 52%, 51.5 of 5 to 11-year-olds here in Chicago have had that first dose. 80% of our 12 to 17-year-olds have had at least a first dose. That's well over the national average, which is 32% of Americans 5 to 11 and 67% of Americans 12 to 17. Really want to see those continue to tick up. They're what make our school, they're the most important thing for, keeping schools safe from COVID, having fewer kids need to quarantine, et cetera. So, should my 5 to 11-year-old get the COVID vaccine? This has been some of the conversation if you've been following. Your answer may come from knowing that yes, the COVID vaccine is comparatively new, but the science behind it is well established, going back well than 20 years. The children's dose is 1/3 the size of the adult dose. In the U.S., more than 8 million children have already had at least one dose. Not seeing new or concerning safety effects there, and of course vaccines, the most important, I would say, public health development of the last 100 years. So, it is the safe thing to do, and happy to take questions there. We've got now 61% of Black non-Latinx Chicagoans having had a first dose of COVID vaccine, and we're making the most progress there week after week, which is good to see. Latinx Chicagoans now as likely as white Chicagoans, both at just over 75% to have had a first dose, and then all three of those major race ethnicity groups continuing to lag Asian, non-Latinx Chicagoans. Wanted to highlight, there was an MMWR that came out this week that was about Omicron transmission within households in 4 U.S. jurisdictions, one of the 4 being Chicago. So folks from the Chicago Department of Public Health, the Connecticut Department of Public Health, the Milwaukee Department of Public Health, and the Utah Department of Public Health all had good enough laboratory surveillance where we were able to not just know somebody had COVID, but know it was Omicron. We had the contact tracing and the case investigation and the sort of science in place to be able to follow up with folks who were diagnosed with Omicron in Chicago and find out who lived in households with them, and then really look to see we know that living in a household with someone diagnosed with COVID is the highest risk factor out there. About 1 in 2 household contacts developed COVID-19 across these 4 settings during Omicron. So that's a lot, but still, it's not everybody. And I think, sometimes I hear this fatalistic, like everybody's going to get it, especially with Omicron. The vaccines don't help. Couldn't be less true. We saw the spread be lowest among household contacts first when the person with COVID-19 did isolate, wore a mask in the home, was up to date with COVID-19 vaccines. We also saw when the other people in the home were vaccinated, they were much less likely to actually develop COVID. And so if you're interested in the exact numbers, please take a look. But really, this multifactorial approach of first and foremost getting vaccinated, but then where somebody does have COVID, being serious about it, the masking, the attempt to isolate, does help even in the highest risk setting of all, which remains household risk. So I wanted to highlight that and congratulate the many City of Chicago and CDPH folks who were authors and contributors to that. So I just wanted to highlight also that you're going to probably see some updated signage in various settings. These are all available on the website from Business Affairs and Consumer Protection, where many settings in Chicago have made masks optional. While this establishment no longer requires masks to enter, please be kind to those who choose to wear a mask. And that also, you'll see this establishment no longer requires masks or proof of vaccination, emphasizing wear a mask if you're experiencing COVID symptoms. Be kind to those who choose who do. Of course, there's a host of reasons why people are masking. They feel more comfortable. They're getting over a cold, like I have been. I've been, you can hear a little bit of laryngitis still in my voice there. I'm continuing to mask. I don't want to spread those germs around. It's not COVID, but I don't want to be spreading that, and I want everybody to keep doing that. There are folks who are immunocompromised, live with folks who are older, immunocompromised, live with folks who are too young to be vaccinated, and really, strongly encouraging anybody who is unvaccinated to continue to mask, even if it's not a requirement at this point. You also may see there are many businesses that have chosen to maintain the mask or the vaccine requirement. That is acceptable. We got questions about that. Yes, that is fine. In fact, we even encourage that where there are settings that are continuing that. So you may see signs like this. While the city of Chicago has lifted the vaccine requirement, this establishment continues to require proof of vaccination. We've seen a lot of our theater settings and music settings choose to continue to do that, which is good and appropriate, and I love it. So yes, that is allowed and appropriate. Similarly, there are settings requiring masks, and then of course there are settings where masks are actually required by law. So in healthcare settings, on transportation, in places like long-term care, in healthcare, in Head Start programs, there are still federal requirements around requiring masks. Our Protect Chicago at Home continues strong. We are not backing off on that. We continue to see Chicagoans use this every day. I do want to note that we may, not just yet, but we may start backing off on some of those financial incentives in weeks to come here. So now is the time, if that's part of your decision, to choose to get some of that vaccine. So more to come on that in the future. Certainly in less vaccinated areas for people who are highest risk, we'll likely be continuing those. But as of now, and for the foreseeable future, we are not backing off on the program. Anyone over 5, no matter who you are, no matter where you are in Chicago, we are happy to bring you a vaccine completely free of charge at home. True for pediatric, adult, and booster doses. We still right now have appointments 7 days a week, 8 a.m. to 6:30 p.m. We may back off on some of that as demand may slow, and we continue to do the $50 incentive gift card for both the first and second doses. So please continue to share that, 312-746-4835, or you can sign up online. We are not letting up on that at all. Treatments also very available. All individuals over 65 are eligible. Doesn't matter if you've been vaccinated. They are no cost. The most important thing is if you get diagnosed with COVID, talk to your healthcare provider immediately. Give us a call if you're not sure what to do. But we want you to be seen because as these IV and oral medications are available, they can help keep you out of the hospital, keep you from dying from COVID. But you got to take them early. You can't wait until you're seriously ill to take them. So we really want you talking to your healthcare provider. And then finally, we got some questions about what did I think about the State of the Union? What did I think about some of what the president was talking about with COVID? And I just wanted to very quickly highlight the 4 main areas that at the federal level they're saying they're doubling down on in terms of protecting against and treating COVID-19, preventing economic and educational shutdowns, preparing for new variants, and then continuing the global work to vaccinate the world and save lives. All of these have implications for us here in Chicago. I was pleased to hear language, for example, about continued investment in growing a lot of the laboratory capacity and the data capacity that we need here on that new variant work. Making sure that, I heard strong commitments to continue to be making tests and vaccines, not just available free of charge, but ramping up U.S. capacity around that. I heard some more about, new potential resources Congress approves for keeping working on ventilation and some of those other things that really help us make all of our settings as safe as they can be. And I was very glad to hear ongoing commitment to that global work for vaccination because getting the whole world vaccinated is as important as getting folks in Chicago vaccinated, where we want to be protected against future variants. We all want to get past COVID. So overall, I think there was some potential good news in there for Chicago. And finally, I did just want to note that the mayor and city leaders, there's a lot happening in the violence reduction space, not just on the police side, but with the Community Safety Coordination Center, which is pulling together departments and programs from within city government, from across the county, across the state, all of the partners that are working on the ground, really trying to take a page out of the COVID playbook here, where the city is not, leading on these efforts in all of these spaces, but we can, we think, play an important coordinating role, making sure resources are flowing, people are rowing together. We thought a lot about sort of people-based strategies, place-based strategies, crisis response in COVID, and we're carrying a lot of that over with this CSCC work. So I just wanted to highlight for Chicagoans a few things around more on the violence prevention side and conversation side happening this month. There are a series of 6 town halls that are open to anybody. Please, if you're interested in this, attend. This is going to be both Chicago Police Department and folks from the city's Community Safety Coordination Center, just having conversations about what's happening in each of these areas. So you can see the dates there. On March 19, there's one for the whole city in Spanish, and you can register at that link at the top. Also, there's a symposium on trauma-informed response to violence that many folks from the health department are helping to lead on March 14. So that's about mental health and substance use and violence prevention. And then there's this youth trade show happening March 22 to 24 at the McCormick Center that's focused on 3,000 seniors at CPS who are at risk of post-graduation disconnection, making sure that if folks don't have plans to go to college, community college, jobs, et cetera, or other risk factors, that there's lots of work with unions and others to help try to make sure people know how to explore some of those careers. So this is just some of what's happening, and encourage you, if you're interested in some of that work, to tune in to the town hall for your area. And then finally, as always, chi.gov/COVIDVax, 312-746-4835. And with that, let's turn to your questions. All right, Lisa Balde Venaria on Facebook. Should the general public plan on getting a 4th dose of the COVID-19 vaccine? How soon do you think a vaccine will be available for children under 5? Okay, good questions, both of those, Lisa. So first of all, there is no recommendation to get a 4th dose of the COVID-19 vaccine for the general public. The only people whom there are different recommendations are folks who have severe, moderate to severe immunocompromise, meaning like you see a special doctor for your immune issues. You have a primary immune condition, you take medications that decrease your immune system, you're on chemotherapy, et cetera. So talk to your doctor if you're being treated for cancer, if you're being treated for some of the rheumatologic or immunologic illnesses, and you know that you would be considered immune compromised, because there are some additional recommendations for those folks. But other than that, for the general public, no, there is not a recommendation for a 4th dose, and that's because, as we've been sharing these last few weeks, as the science, has continued to emerge, it looks good, it really does, around that 3rd booster, especially in terms of protection against the severe outcomes. So I don't anticipate we're going to see a recommendation for another booster anytime soon. I think the big question would be if we saw a new variant emerge and the vaccine were not as protective against it. That would probably be the setting. That's why I'm glad to hear sort of at the national level there's this commitment to ramping up further our ability to quickly produce vaccines in the U.S. Should that be necessary. I think that's good not just for COVID but for all of the other vaccine preventable diseases. But no, I don't expect to see any recommendation on that. At this point, I wouldn't expect to see anything for months. But obviously, if it changes, we'll let you know. How soon do I think a vaccine will be available for children under 5? So realistically, probably not until early summer. I do think next month, in April, we will probably, hopefully, see the data from the trial. And let's just remind you, for those of you who haven't been following this as closely, in the 2 things that the FDA and the CDC look at when they make recommendations around whether to approve a vaccine: number 1, safety; number 2, efficacy. First and foremost, the vaccine's got to be safe, or it will not be recommended. Number two, it's got to show that it's effective. And what we saw was that all of the safety data was beautiful for the kids under 5. There was a decision in the Pfizer trial to use a very small dose for kids under 5. Remember that kids 5 to 11 get only a third of the dose of kids over 12 and of adults. And one of the reasons for that decision was that, the safety data was beautiful and the efficacy data looked good for that group. It's interesting because what we've seen is with Omicron, especially on the older edge of that 5 to 11-year-old group, we have seen more breakthroughs, and it has raised some questions about whether that dosing for the older edge of the 5 to 11-year-olds, it's still very effective, especially severe illness, et cetera. But we have seen some more breakthroughs in the older end, in particular, of those 5 to 11, and we may see a recommendation for a booster or a third dose. Not at this point, but we may see one. That's one of the things the science is still out on in terms of study. But the safety data was good. The efficacy data was good. What happened was for the under 5s, they decided to use a 1/10 of the dose. That is a tiny, tiny vaccine dose. And the safety data, not surprisingly, absolutely beautiful. The side effect data, beautiful. But in, again, the older kids in that group, the 2 to 4-year-olds, they didn't see the efficacy that they were expecting, meaning the levels of antibodies, weren't as high as they were expecting. And so there was a decision not to, what the debate had been, do you move ahead when the safety data looks good and we're in the pandemic? Do you move ahead with starting with those first 2 doses with the assumption, as we often see for younger kids, it's not that uncommon to need to do a number of, more than one vaccine. The assumption that with the third dose, we wouldn't really call it a booster, we would just call it the third dose, that the protection will be there. But the FDA decided to wait for that data, which I think is appropriate. We want to make sure that we are maintaining full confidence in these vaccines. And so in April, I think we should have the trial data where Pfizer will be able to share, did that third dose give the safety data continue to be excellent, which I expect it will, but did it show that efficacy? And if it showed the efficacy, then I would absolutely expect the FDA and the CDC, they look at all the data, they'll do all the debate, it'll all be public just as they did previously. But I would expect certainly to get that green light probably in the May-ish timeframe, and we may be vaccinating sort of late May, early June as a guess. But it all depends always on the data and on those trials. So I know it's hard for those of you with little ones who want to vaccinate the kids, but please know that when there is a vaccine available, it will be a vaccine that is not only safe, but we know is effective for those kids. Maggie S. on Facebook, is it possible to continue to test positive for COVID after 4 weeks of no symptoms? I plan on traveling internationally this spring. Yeah, Maggie, that is an important question. So first of all, yes, especially with PCR tests. Remember, the reason CDPH does not recommend, and neither does IDPH, and neither does the CDC, and neither does anybody, nobody recommends a negative test to return to work, et cetera, especially a PCR test, because those PCR tests, they're very sensitive. They can keep picking up dead virus in your nose sometimes for weeks, but you can't grow that virus in the lab. You can't spread it, but it can be positive. So yes, and it can happen for even 4 weeks. It doesn't mean you're spreading COVID. So I like this second part of your question because not everybody thinks about this. I plan on traveling internationally this spring. Please, if you test positive for COVID on a home test and you're thinking about traveling internationally in a few weeks or even a month or two, I can't advise you strongly enough, go get a formal lab test. You want to be able to document that you have a positive PCR test, because if you're one of those folks who continues to test positive, potentially for a month, for example, the U.S. you cannot even get back into the U.S. with a positive test unless you can show it's the result of having had an older positive test, and those officials are not going to take your word that you had a positive home test. So if you're traveling internationally, number one, of course, get vaccinated. It's hard to travel internationally unvaccinated at this point. Many countries won't let you do that. But secondly, know that there continue to be testing requirements, and the U.S. continues to require everybody, regardless of whether you're a U.S. resident or citizen, a visitor. Everybody has to get a negative COVID test to come into the U.S. The masks remain required on the airplane. All of that, none of that has changed. And you don't want to be one of those people who had COVID a few weeks ago, and then there you are in Mexico or something having a positive COVID test. They won't let you back into the U.S. So it is possible, and get a formal test if you're going to be traveling internationally. I'd say it's probably the one most important setting where you actually need that proof. Otherwise, you treat a positive as a positive. A home COVID test, positive, treated as positive, isolate, et cetera, et cetera. Nothing has changed on that. Brian C. on Twitter, can you define a congregate setting where these masks are required? Is O'Hare a congregate setting? If a gym has 100 people in it and limited distancing, is that considered a congregate setting? Yeah, that's a really good question, Brian. So where we're talking about congregate settings in the COVID sense and in the sort of mask and extra requirement sense, we're actually talking about places where people live together. So we're talking about shelters, we're talking about group homes, we're talking about long-term care facilities, we're talking about correctional settings, places where folks are, they're not in their households per se, but the place where they live is in a congregate setting, which of course is higher risk. And so it is the settings like that where the state, for example, is talking about congregate settings, that would be required. So no, a gym, even if it has a lot of people in it, a church, even if it has a lot of people in it, a gathering of a lot of people is not a congregate setting in that way. So I hope that helps clarify the difference. There certainly are settings where any gathering may decide to require masks that is appropriate, but that would not be part of the City of Chicago requirement while we remain at a low risk setting. All right, I'm seeing a comment here. Somebody who's posting People's Tribune from Chicago area. She said the PCR tests are not reliable and can pick up dead COVID cells. That I do not mean that the COVID tests are not reliable. They are very reliable. They are the best at picking up COVID if someone is positive. A positive COVID test, whether it is a PCR test, whether it is an antigen test, et cetera, is a positive test. It is extremely reliable. The part, and this is not anything that has changed, is that a PCR test can stay positive for a long time. So remember, the recommendation and the requirement, in fact, is that when you test positive for COVID, whether that's an antigen test, a PCR test, an at-home test, I don't care. Positive test is a positive test. You must stay home for 5 days and until you are feeling better. And then for days 5 through 10, if your symptoms have resolved and you're feeling better, you can go out from your home. You need to wear a mask for days 6 through 10. That is true still and always. That has not gone anywhere. That is true if you're out and about in public, you gotta have that mask on. But it is true and always has been true that PCR test can stay positive for a long time. And so it is in that setting that you want to make sure, especially if you're traveling internationally, that you don't get stuck somewhere. But yeah, they can pick up, they're so sensitive that they can pick up sort of remnant COVID at a time that it won't be there. But did you have COVID? Yes, you did. And were you spreading it back when you first tested? Yeah, lots of potential to do that. So thank you for that clarification. Kathy Powers, I think, was raising that. So thank you for that. All right. GG at GrammarGirl27 on Twitter. Why are businesses still mandating masks? So once again, depending on the business, they are absolutely allowed to, and in fact encouraged to, if it makes sense for their setting. We've gotten calls from performing arts organizations who say, you know, a lot of my patrons are older, they're really nervous about coming to the theater or coming to the opera or coming to the symphony, you know, et cetera. Part of them feeling comfortable about doing, you know, coming to a place that might hold 1,000 people is knowing that everybody in there is vaccinated and we're continuing to mask. That has been good for our business model. That has been good for our customers. Of course, we're supportive of that. In the same way, there are some restaurants and some bars that have said, you know, we've really heard from our patrons that they like the vaccination requirement. It helped, you know, and where they're wanting to do that, we are in support of that. It is not a requirement, but there are certain settings still where it is a requirement. The healthcare settings, the Head Starts, there remain federal requirements around that. But a business can make that business decision at this point. Many are very excited to be in a point where they can lift masks, and we can. But if you're a business catering to seniors or to people who are, you know, known to have underlying conditions, you probably are, your business probably is going to do better business with some additional protections in place. And we recognize that and in fact support that. So I think that's probably the reason. And again, when people are wearing masks, they are protecting others, they are protecting themselves, they are protecting Chicago. And COVID risk is not gone. It is very low at this point, which is why we can lift it at the city level. I'm thrilled to be able to do that. But please be kind to people who choose to continue to wear masks and to settings that choose to continue to require them. And some of them are making that decision for business reasons. All right. Yeah, I'm seeing Namrata Batra and Lee Mabry White both asking about this, and Adair Small, about this efficacy of vaccine in 5 to 11-year-olds. So yeah, this really was with Omicron. That's what I was talking about, that especially in the older kids, they saw more breakthrough infections than they were expecting. And I think, you know, the hypothesis on that is that it probably is that lower dose. There has been no change, to be very clear, in the recommendations. Still very, very strongly recommend that 5 to 11-year-olds get that first dose, that second dose. I think we may see a recommendation for a third dose. May we see some different spacing in the future. It's possible that we could, but at this point, there's been no change to the recommendation, yeah, I think it does probably have to do with the dosing. The trait, you know, it's extraordinarily safe. The side effects are next to nothing. But we do want to make sure that protection is there. So please, you know, I don't want people feeling like, oh my goodness, my child isn't protected. It is the most important thing still. There still is some protection, but we saw more breakthroughs than would have been expected in that group. Still, if your child is vaccinated, they don't have to quarantine. If they're exposed to someone in school, for example, whereas they do, if they're unvaccinated, none of that is changing. And we're keeping an eye on it, as is the FDA and CDC. But the vaccines, including for kids, continue to be very safe. They continue to be effective, just less effective with Omicron, especially in the older than had been expected. So we'll be watching that. If there are recommendations for different spacing in the future or for a booster in the future, of course we'll be sharing that with you. But I remain very comfortable when I see you know, kids who are vaccinated. Oh, and then maybe just as a final, we are nearly having to, there's a number of good additional questions here. All right, I'll try to get through them quickly. So first of all, Lisa Martin on Facebook. Though I am thankful for the great work she has done for Illinois, I am sad to see that Dr. Ezike is leaving IDPH. Do you have any plans to step down for your role? So Lisa, you know, I have also been, you know, really thankful to have Dr. Ezike, you know, as a partner. We talk a lot, you know, I told her I was feeling a little jealous of her for getting to have a full-on vacation, but no, I am not going anywhere. I am there's nothing I would have rather been doing for these last 2 years, hard as they have been. And I am extremely committed to my team, to this work in Chicago, and frankly to what comes next, right? There's a lot to do. There's a lot to do around ensuring we are entirely prepared for whatever is coming next on the COVID front. There's a ton to do on the indirect effects of COVID. We've already been doing a lot of it, but much more in the mental health space, in the substance use space, the indirect effects. And there is a lot to talk about how do we make sure we have a strong public health system in this country. And I want to be very much in the middle of that conversation. So no, I remain as interested and committed to this role as ever. And of course, I wish Dr. Ezike well, and I am a little jealous about having maybe a little bit of a real break there. But I love the work I do. And we are planning to continue these Facebook Lives too. We may back off possibly to once a week. We'll see as we see how this next bit goes. But I plan to continue to bring folks in to talk not just about COVID, but about the work of public health in Chicago, answer your questions. It's, as I said on last week, it's been really helpful for me. So thank you for that shout out. Jean Brooks on Facebook. I know it's chaotic. Is there any effort to vaccinate the folks coming out of Ukraine if they are not vaccinated? That's an important question. And the short answer is yes. And in fact, whenever there are refugee situations, which unfortunately in this setting, there are big refugee, there's been, I was reading, 1 million maybe folks even, all of the agencies and groups and countries that are part of that put a lot of focus on health. And in fact, we, not just for, back to that sort of congregate living thing a little bit, especially where we see disruption at times of war. That itself is a huge risk factor for disease. It always has been, it always will be. And where you think about people, not being able to access care, where you think about people potentially living in these sort of congregate settings, vaccination and other preventive public health things are a big tool that we work hard to make sure people can get access to. And even, to give you a sense of this, no matter where folks are coming from, refugees, immigrants, when they come to Chicago, there's a lot of extra work that happens to make sure that they are entirely up to date with vaccines. There's tuberculosis testing that happens. The Chicago Department of Public Health works to follow up with anybody who has a positive skin test for tuberculosis. Doesn't mean they're infectious or anything, but to make sure they can get treated and followed. There's a lot of attention on this. And even in a crisis, we want to do what we can to try to stop the crisis from becoming a health crisis in that way. So thanks for flagging that. And yeah, it is something that we think about health concerns there a lot as well. All right, I think we are just about at time here. LaMaya Davis on Facebook, when will oral treatments be available to all medical facilities in Illinois? So, our focus, of course, is Chicago, not Illinois. As I said, I was pleased to hear the president talking about continuing to ramp up. I can tell you, for example, for Pfizer in particular, which is the one that has the best data at this point. Everybody's not eligible for one thing, and you do need to be connected to healthcare, et cetera. I am most interested in making sure healthcare settings, and I know that's a plan at the national level. It's why we've pushed federally qualified health centers. It's not just can I get the pills, it's can you get the healthcare that comes along with it. And making sure that there's roles there. But I can tell you there's been about 4 million courses so far of oral treatments available across the US. There's another 1 million of the Pfizer that are coming in March. I think another 2.5 million planned for April, about 20 million over the next little bit here, at the national level for that Pfizer course. That should be enough. They're ramping up production every way that they can. But already, at least here in Chicago, it's less an issue of is it available and more an issue of making sure people are calling providers early. And we've been doing a lot with our providers to make sure they know how to get it and how to get connected to it. And we've put a particular focus on our federally qualified health centers and others that may serve people who are lower income, have more barriers, maybe uninsured, and making sure that, especially in those settings, folks know how to access this. But please know that it's not quite as straightforward as vaccine. You need an assessment. You need some lab work. You need, it's not appropriate for people with some underlying conditions on certain medications. So there is quite a lot of work around that. All right. So I think we are going to kind of call it a day for right now, just because there's a number of other interesting questions, but maybe just as the very last one, I'll take just Sarah Good Mosley on Facebook. I've been reading some doctors are concerned we're lifting mask requirements a little too quickly. Can you speak to those concerns, your confidence that people are safe? We have a 60-piece community band, all vaccinated and boosted, want to ensure we're rehearsing and performing safely. Yeah, so what I would say is that all epidemiology, all risk at the end of the day really is local. It has to do with what is the likelihood that when you are out and about in your life, in the people who you are interacting with in your community, what is the risk? And I tell you honestly, in every single way that we measure it, here in Chicago, we are at low risk, and it is appropriate. I'm very glad to hear everybody's vaccinated and boosted. That is the most important thing. I would encourage a band like that, don't let up on the other things, right? Anybody who has even potential symptoms of COVID, take a test, take a test, take a test. Stay home until proven otherwise, right? Don't risk with that, you know, et cetera. But if people are feeling well and they haven't had an exposure, it is appropriate for your 60-person band, yes, even that, to be rehearsing. And you know, can I promise you that you will never see a case of COVID? I cannot. Do I think the risk is low here in Chicago right now, especially in a all vaccinated and boosted? It is. And I think that when we're balancing those things, I want to be honest with you. If we were in downstate Illinois, those areas that are orange right now, that would not be my recommendation. But right now, here and now, I feel strongly, and so does really just about everybody who's looking at this. And so we are going to continue to be transparent with you about our metrics, our risk, and where we are. And we may make recommendations in the future if we have to. We may do requirements in the future if we have to. But I believe so strongly that when the risk is low, being honest about that and about lifting the requirements. Because I want you all to sort of believe the data, believe the risk. And when it is low, we need to act on that, in my opinion, at the city level, in the same way that we need to do that when the risk is rising. So that's what I would say. And thank you again for your questions, your comments. We will be back next week. I think we will probably do both a stand-up and Facebook, just to kind of do some updates on where things are. But regardless, we'll be back with you. I think we're planning to be here at the regular time on Tuesday. So send your questions if we didn't get to that. If we didn't get to you today, sorry. And thanks. Keep sending them in and keep being safe. Enjoy the beautiful weather, and be kind to everybody who are making the decisions they're making around COVID right now. Thanks. Bye-bye.